Hi, this is Dr. Kissen. I wanted to take a few minutes to give a quick update to my site visitors. As you can see, it's rather informal, but I have had on my mind the last couple of days a message that I wanted to send out to my site visitors, and I figured now is as good a time as any to share this information. So I receive on a daily basis many emails from anxiety disorder sufferers. Most of the time, it's panic disorder sufferers that are reaching out to me. Often I get emails sent at 2 a.m., 4 a.m. saying, please help. Panic is destroying my life and I am no longer functioning and I feel like I can't go on. Themes like that. And I just wanted to share with my site visitors, with those struggling with panic disorder, that there is so much to be hopeful about, and I understand what it feels like to be at the worst point with your struggle with anxiety, to have moments where the discomfort does not feel like it will ever pass, and there's any way to get past it or through it. But what I do know personally and professionally is that there are many tools in the toolbox to get past anxiety. The ideal set of tools that I would recommend to get past severe anxiety would be, number one, effective therapy. CBT for anxiety entails one critical element of which is exposure-based therapy. That means working with a therapist, ideally, to have some assistance, and coming up with a hierarchy which outlines step by step how to face your fears in an organized fashion that, by doing so, teaches your brain that it has nothing to fear, and therefore it can reduce the anxiety signal that it is so frequently sending out in your current life. You can teach your anxious brain that it's okay, and that's what exposure-based therapy does. The next tool in the toolbox is certainly medicine, and many individuals struggling with anxiety disorder state, I'm too afraid to take medicine for my anxiety, and so they're stuck between a rock and a hard place. And often in my practice, I spend a good deal of time with my clients just getting them to the place where they're ready to take medicine. And once they do open themselves up and show willingness to take medicine, they find freedom that they didn't know possible. And so studies have shown the combination of SSRIs combined with CBT therapy is most effective for moderate to severe anxiety disorders. And then there's lifestyle changes. Exercise is super powerful at decreasing the anxiety signal. Sleep regulation, getting on a good sleep schedule and sleep hygiene. Social engagement. Don't let anxiety stop you from connecting with people in your lives. Behavioral activation, living the life that you would live if you didn't have anxiety. And the more you live that life, the quieter the anxiety gets, which is the opposite of avoidance. And then there's alternative medicine or alternative vitamins such as fish oil that have been proven to be, or shows some promise of being helpful at decreasing anxiety. So what I hope to send out to my visitors is a message of hope. And if you're in a really awful place with your anxiety, know it's only going to get better. And I've seen numerous, I can't even count the number of people that have been at points of despair that they've considered suicide because they're so uncomfortable from the anxiety, pretty quickly get to a place where they're living a full, vital life, and the anxiety shows up sometimes, but it's manageable, and they ride through it and live the life that they'd always hoped for. So that is my message for hope, and I will reach out again sometime soon. Bye.